Hey everyone, we're here at the Health 2023 conference and our guest is Matt Hollingsworth, the CEO of Carta Healthcare. Welcome, Matt.
Thank you. Thanks for having me.
Yeah, so tell us, what's a problem, technology, opportunity, or maybe an issue that's not enough people are talking about?
So I think one of the biggest things to talk about now is just how hard it is for patients to move their health data from one place to another. I just had a kid with a really complex congenital heart defect where I had to move from Portland down to San Francisco to have a surgery done. And it took me better part of 3 weeks to move the data back and forth. And at this point, we've done a really good job passing regulations to make that easier, but the actual true linkages haven't happened yet. And I think we're at the stage at this point where you really could fix it, and it's really worth the time to do so. So it'd be great if we heard more about that. And I think we could see within a year, we could fix it with the technology infrastructure that we have in place, and that would be really wonderful.
Awesome. And what are some of the uses of AI you've already seen implemented in healthcare?
So I think first I want to define AI, because I think one of the problems here is that people define it differently. I would define AI as the field of applying technology to solve problems broadly. And so an important thing to remember is that that definition has sort of opened up many use cases as time goes along. And I want to give an interesting one, because I think you'll hear a lot of other things that you may expect. I'll give you one that you don't expect. I think my favorite application of AI is a pulse oximeter that is a pleth, as it's called. It applies Kalman filters, it applies all wonderful AI algorithms to spit out that number that you get. But a lot of people don't think about that as AI, despite the fact almost everyone has interacted with it. And I just want to use that as an example to prove the point that everyone has interacted with AI, even if they don't feel like they've done it before. And they're wonderful applications, but some of them have become so commonplace that we forgot that they're actually AI. So I just want to point that one out, because it'll be a little different from what you might hear otherwise.
Awesome. Thanks, Matt.
Of course.